Concern is deepening over the widespread use of a chemical called BPA. It's commonly found in plastic containers and the linings of food and beverage cans. But BPA can get into food and drinks, and studies have tied it to a wide range of health concerns. Now, scientists at the Columbia Center of Children's Environmental Health here in New York have linked BPA to an increased risk of asthma. Dr. Kathleen Donahue is the lead author of the study. Dr. Donahue, Kathleen, good morning. Welcome.
Good morning. Thank you.
First of all, what is BPA?
So it's a chemical that's used to make hard plastics like polycarbonate and in food can linings.
And why are children so vulnerable to it?
Well, they eat more per kilogram of body weight than adults do, and most of our exposure is through our diets.
So, are we talking excessive exposure here, or is just, moderate exposure going to affect people?
So our study found that routine low doses of exposure were associated with increased odds of wheeze and asthma at school age. So it's ordinary exposure.
And I was going to say, we've been seeing this increase in asthma among young people. Do you think that this is linked to their BPA exposure?
Well, our study suggests that it might be. It's the first one, and so we'd like to see the results replicated in another study, and we'd like to have more information about the mechanisms to confirm that it's a cause. But our study suggests that it might be one of the environmental exposures that may have contributed to the increase in asthma over the last 30 years.
Does it look like adults are being as much affected, or children? The risk is more with kids?
So our study found the link in children, but we didn't look in adults, so I can't speak to that.
How about pregnant women? Are they passing it down to the fetus?
They do. So, we know that the primary route of exposure for women is also through their diet, but they transfer it through their bloodstream and through the placenta to the fetus.
Last year, the FDA banned the use of this BPA in baby bottles and sippy cups. You think that's going to help?
Well, so if other studies confirm that this is in fact a true cause, then yeah, banning it might reduce some of the asthma cases.
In the meantime, for people who are hearing the results of a study like this, what are your recommendations for how people should go about serving their children and even pregnant women deal with this?
Sure. So the National Institute of Environmental Health has a couple of recommendations on their website based on evidence, and they suggest that you eat less canned food, to use stainless steel or glass containers for food, particularly for hot foods or liquids, and to avoid plastics numbers 3 and 7, the little triangular recycling symbol 3 or 7.
Well, those are things I never even look at, but you're telling me I should be looking at them.
Yeah, or before you buy the product, as opposed to when you're tossing it into the recycling container. Yeah.
And also, if you're microwaving, you shouldn't use plastic food containers, right?
That's right.
Okay.
Dr. Kathleen Donahue, thanks so much. Appreciate it.
Thank you.